Welcome to the podcast of the Journal of the American Society of Nephrology. I'm Josie Briggs, Editor-in-Chief of the Journal. Each month in this podcast, we talk about some highlights in the current issue with the hope this discussion will prompt you, our listeners, to go to our website or turn to the latest issue that is now in your mailbox. This month, in the February issue, we are introducing a special interest series titled The Health Policy Catalyst. The series will be co-edited by myself, Neil Poe, and Tom Hostetter. Tom provided the impetus for this series. He reminded us that 2023 marks the 50th year since the passage of the ESRD Act that extended Medicare coverage for individuals who require renal replacement therapy to sustain life. He suggested it was a good occasion to mark with some reflection and potentially some debate. And indeed, health policy is the subject of much discussion and writing these days. For example, in the pages of the New England Journal and JAMA. The pandemic experiences have created an intensified awareness for all of us of the grim lists of systemic weaknesses in the delivery of care, and indeed weaknesses in the systems that support the needs of people providing health care. I know our listeners are well aware of this. Many of the issues, especially those covered in JAMA and New England Journal, cross disciplines and subspecialties. But here at JASN, we want to talk about issues where nephrology care is front and center. And frankly, it needs to be, both because of the special vulnerabilities of the patient with kidney disease and because of the costly demands and resources needed to care for the patient with failed kidneys. In the 50 years since the passage of the ESRD Act, indeed much has been achieved. Approximately 500,000 people are receiving dialysis, and almost 250,000 people are living with renal transplant. Over these 5 years, millions of lives have been extended, and we have what is almost, at least, a single-payer system. And we have pretty high-quality data, for example, from the USRDS and from the transplant databases. So we have excellent resources to know how we are doing. But as all our listeners know, there is much about the status quo that needs examination. In our introductory editorial, Tom, Neil, and I provide a short list of topics about which we would welcome submissions. We welcome both original articles with rigorous, high-quality, well-analyzed data, and perspectives that provide a specific point of view. All submissions will undergo tough peer review. Here's a short list of some of the topics. It's important to talk about steps to continue in the continued battle to reduce ethnic and racial inequities in kidney health, and particularly in ways to reduce the impact of structural racism in the delivery of care. This broad topic is a continuation of our special series in 2022, edited by Dawn, and Dawn will take a big role in looking at this work. Second category is approaches to evaluate the effectiveness of alternate payment models to promote patient value, patients' quality of care, and well-being, and indeed steps to understand and promote more cost-effective care. Important topic is approaches to address inadequate or non-existent insurance coverage for kidney disease patients, including undocumented immigrants. We're interested in people's thoughts on policies that will protect patient choice and protect physician autonomy as the advocate for the patient's interest. We're interested in steps to identify and mitigate unintended consequences of quality measures. This is a short list, but by no means a complete one. Okay, work in the February issue addresses two tough issues. The need for more attention to cost-effectiveness issues in dialysis care, and the need to protect the interest of kidney patients facing unwanted pregnancies. To the first topic, rigorous cost-effectiveness analysis. Dialysis care is a big driver of costs for our health system, and the rigorous methods that exist to assess value, generally called comparative effectiveness research, or CER, are underused in assessing dialysis care. The concrete application we present in this issue is a study looking at hepatitis C screening. The work is by Rachel Epstein and colleagues. Their paper is entitled A Microsimulation Study of the Cost-Effectiveness of Hepatitis C Virus Screening Frequencies in Hemodialysis Centers. Current guidelines from KDIGO call for Hep C screening every 6 months. The team of Dr. Epstein and coworkers used data from the USRDS and data from a recent clinical cohort study of patients with Hep C to define the variables needed to estimate cost effectiveness of different Hep C screening intervals. Central to the study is a model of outbreaks of Hep C within hemodialysis centers. It's a very readable study. They go through current guidelines and then how they arrive at the estimates for the model. And conclusions, the study provides very well-grounded evidence that Hep C screening at the initiation of dialysis and every 2 years gives good economic value. But more frequent screening is not a cost-effective use of healthcare resources. The differences they show are quite dramatic. The incremental cost-effectiveness ratio, the ICER, of screening every 6 months is about 6-fold higher than the conventional willingness to pay of $150,000 per QALY. Hank Zen and Eugene Lin provide a strong editorial that places these findings in context and helps the reader understand the basic concepts of CER. Their conclusion is that the findings justify a revision of current guidelines. Their final summary is, and I quote, "Given the high cost of hemodialysis overall, opting for a more cost-effectiveness HCV screening strategy may allow providers, particularly in safety net settings, to prioritize higher value care." The editors felt this work was important, not only because of the specific issue of Hep C screening, but also because we hope it will increase awareness of the methods used in this excellent study. Nephrology has strong data resources for the work of this sort, and we suspect there are many aspects of care that would benefit from the type of analysis illustrated by this work. The second tough topic we take on in the February issue is the special reproductive health needs of women with kidney disease. The renewed importance for attention to the topic is precipitated by the Dobbs versus Jackson Supreme Court decision of June last year. We present in this issue 3 perspectives on this topic. One addresses the overall concerns, one reviews the special issues that arise in the care of adolescents with kidney disease, and the third catalogs the complex issues about decisions about pregnancy for women with transplants or on transplant waiting lists. We suggest all providers caring for women with kidney disease need to be informed about these issues and indeed about state policies on them for where they work. Some of the policies are changing rapidly. And we believe, as nephrologists, we need to be prepared to be advocates for the best interests of our patients. That starts with awareness of the increased risk of pregnancy for the patient, for the fetus, and in the case of transplant patients, for their allograft. We suggest these forceful perspectives will help our readers to be effective advocates, both advocating directly for individual patients and advocating for local policies that will help providers provide optimum care. So, listeners, I hope you find elements of interest in this issue and will continue to find our Health Policy Catalyst series to be provocative. Policy occurs at many levels, not just in congressional mandates and central reimbursement policies, but also at the state level and indeed within practice groups and within hospital systems. Effective advocacy for policy matters starts with knowing the facts, and JASN aims to publish work that will help you to be an informed advocate. Thank you for your attention.
This podcast is copyrighted by the American Society of Nephrology. All rights reserved. All content in this podcast is for informational purposes only and is not intended to be medical advice. This podcast should not be used in a medical emergency or for the diagnosis or treatment of any medical condition. Please consult your doctor or other qualified healthcare professional if you have any questions about any medical condition or before taking any drug, changing your diet, or commencing or discontinuing any course of treatment. Thank you for listening to this podcast from the American Society of Nephrology.